Good day, everyone. I'm Dr. Gomez Chua, and we will be discussing how a school clinic and the primary care system are actually related. Let us first review what a school clinic can offer. We have discussed in our previous lectures how school clinics can help with infectious disease control, or how they are important health promotion for nutrition, hygiene, physical activity, and mental health. Let us also discuss some other roles a school clinic may have. One important role is in providing care for students who have chronic conditions. This involves people with asthma, allergies, diabetes, or anything that needs continuity of care in school and at home. This also involves talking to parents and caregivers how to support students with conditions, such as, for example, discussing their medication, their diet, and things that teachers and staff need to know with helping the students. This also involves being able to refer if ever a student needs emergency help because of his or her condition. A school clinic should also be able to integrate health concerns and health promotion into the curriculum. A provider may be a resource person or may help the teachers and the administrators design a health promotion or health education lecture or co-curricular activity. School clinics should also be involved in gathering data for disease surveillance and notification, as we have discussed before. And also, another important aspect of school clinics is also the school staff and employee wellness. This involves our annual physical exam for school staff and employees and providing care for their acute concerns. And lastly, school clinics should also be able to coordinate with parent-teacher associations and other groups in the community to promote student wellness. These sound familiar because these are also part of what primary care also handles. What is primary care? Primary care is basically the first contact of an individual into the health system. This is the first consult, the first time a person seeks help from a doctor, a nurse, a midwife, or some healthcare provider. Primary care has some characteristics. The first is that primary care is person-centered. Usually the person who seeks help in primary care has an unspecified complaint or illness. For example, like a headache, a stomach ache, a muscle ache, or something that cannot be easily pinpointed. And the provider should be able to treat this person and not just the illness. And it is person-centered because it is also able to cater to all life stages. For example, how you care for a child is not the same as you would care for an adult. Primary care is also very team-based, so providers should be able to work with specialists and other professionals to provide health services across the board. This includes laboratory. This also includes, for example, mother and child services. This also includes, for example, working with specialists for procedures or to provide additional care or expertise about rare concerns or rare diseases. Primary care is also community aligned. This involves having to work with the community's values and beliefs and their context. A provider should be able to know his or her community inside and out, how they think, what they believe, what are their leaders, what are their superstitions, what are even their politics. This has to involve being able to work with the community. And lastly, primary care is equitable. The care has to be cost effective and has to be able to provide the most benefit for the least amount of resources. Hindi pwede or wala dito or it's not allowed to have these very expensive interventions or to have these very costly procedures that a patient cannot afford. Primary care has to also consider what the patient has to be able to access. A school clinic is actually one type of primary care facility. The biggest difference is actually the scope. School clinics are able to cater to students and teachers in one area, but primary care has a much larger network or a much larger community to take care of. In a sense, a school clinic is actually only part of a local primary care system, which is actually part of a local health system, which involves all the hospitals and all the facilities in one area, and all the local health systems of a province or municipality or just any given area are part of a national health system. And lastly, school clinics and primary care facilities in communities should also take active roles in health promotion and should have a network of referral systems. If there's a concern that needs advanced care, a school clinic and a primary care clinic should be able to do the referral. But then we have also touched upon primary care and school clinics and health promotion. A framework that makes this work is the FRESH framework. This stands for Schools, Agencies, Systems for Reducing Risks, Equality, Social Development, and Health. These actually has four pillars that are already part of our DepEd system. One important part is policies that are supportive of school health and development. So these are our DepEd circulars and ordinances and policies that we have been doing for so many years. This also involves skills-based health education, which is involving co-curricular and non-formal activities and routines. So this has already been touched on in health promotion. Our school clinics also have a defined set of basic scalable services to support educational success and health development. These are our screenings, these are our regular school activities for school health. And lastly, school clinics should also be able to promote a safe, sanitary, healthy physical environment and a positive psychosocial environment. So this is a part of our lecture 6 about nutrition, hygiene, and mental health. So with these 4 pillars in mind, the school clinics and primary care can also work together for multi-intervention programs. So these are exact interventions for a school, for a community, and these are targeted towards exact needs for that area. So for example, in one place there's a dropout problem, a school and a primary care facility can work with cash incentives so that students can stay in school or rise for attendance programs. Or an example would be gender sensitivity. So this is an example that has been done in different schools, for example, for menstrual hygiene. Another example would be education in pandemic settings or education for students who are living in high conflict areas. So these multi-intervention programs are exact needs and programs that work within a larger framework for school health and primary care. So it is important to remember that primary care and school clinics are not separate, they don't stand in a vacuum, and that they should work together to be able to make things better for students and learners and the entire school community as a whole.